I was studying for the clinical boards. I was sitting around the table with a couple of my friends during our time off. And we remember asking each other what we'd like to do, what would be our perfect residency. And I thought to myself, wow, how exotic and adventurous would it be to do a residency in a developing country. And so I just remembered thinking that there was an organization out there called NDI.
Hi, my name is Dr. Tabitha Parker de Guzman. I'm a naturopathic physician and the Executive Director of Natural Doctors International. NDI is located in Portland, Oregon. We're a registered 501c3 with the federal government of the United States of America. And we also work in Nicaragua, where we have a contract with the Ministry of Health and are registered with the Ministry of Government. NDI was founded in 2003 by a group of naturopathic physicians. Our goal was to create an international medical relief organization that was for and by alternative medicine practitioners. Since our inception, our mission has expanded to not just include international health clinics, but also global health education, medical research, and international health policy. NDs are uniquely equipped to serve the medical needs of underserved communities internationally. Because of our extensive clinical training, along with the variety of alternative medicine modalities we learn, we really have an amazing toolkit to use when we're providing medicine for underserved communities. NDI's first clinic is located on the island of Ometepe in Nicaragua, in Central America. NDI chose Nicaragua because there's a great need for primary care medicine, and the people have very much embraced natural medicine. The NDI clinic is open to people of all ages, from infants to the elderly. Our clinic is completely free, including the medicines that we give out.
Ve qué bendición. Ahora yo le doy gracias a Dios que esa pastilla pues, o ese medicamento, pues ustedes pues gracias con la ayuda de Dios y de ustedes, que ella pues está tomando ese medicamento, si no, yo quién sabe cómo no se la hubiera comprado. Hay una felicidad un poquito en ella.
Sí.
Dígale que se siente muy feliz.
Sí, me siento feliz
Y alegre.
y alegre.
Our clinic is located in the Hospital of Moyogalpa, where we work collaboratively with all of the doctors and the Ministry of Health.
Mucha población que muchas veces ha acudido a consulta con nosotros como médico general ha resuelto su problema respiratorio, su problema de la piel con medicamentos como alternativa que ofrece la organización NDI al cual Tabata pertenece. Son un impacto muy bueno que ha rendido fruto a nuestra población y de gran aceptación.
Like many developing countries, the healthcare situation in Nicaragua is very poor, lacking infrastructure, basic supplies, and medicines. On an island of 40,000 people, our hospital is ill-equipped to provide emergency services. We lack defibrillators, oxygen, X-ray machines, and other basic supplies such as gloves, gauze, or needles. NDI works with two local Nicaraguan farms, Isnaya and Sicali, that are located in Esteli, Nicaragua. The quality of natural medicine that they produce has been wonderful for the patients in our clinic. While NDI does buy some natural medicine here in Nicaragua, the majority of our medicine comes from generous donors in the United States and Canada. Without these generous donations from companies in the US and Canada, we would not be able to provide the services that we do. NDI teaches global health courses. These courses are 10 days in length and run 4 to 6 times a year. People often ask me why the NDI Global Health course is unique, and it's unique for several reasons. First of all, it's the only global health course of its kind that is taught by naturopathic physicians, and it allows you to really see how naturopathic medicine is being practiced in an international setting. In addition to working 4 days in a clinical setting, students and doctors also attend classes on globalization and the impact globalization is having on health around the world. Students and doctors are often challenged by the state of health that they see here, but at the same time they're touched by the humanity and the generosity of the people of Ometepe.
My expectations before coming to volunteer in Nicaragua were to fully experience the culture, because I knew I'd be living with a homestay mom, and there would be a language barrier for sure since I barely speak Spanish, but I was looking forward to seeing how I would do. So what has struck me the most in my experience my 4-day experiences in the clinic in Nicaragua is how patients here are so open with us. It's usually one naturopathic doctor and 3 or 4 of us students in the room, and they're there sharing what's wrong with them, and they look at all of us even if they know that we can't speak Spanish. They really include us in their sharing process, and they're very open to us, checking out their ears or listening to their lungs. So it's not only the doctor doing it, it's like 4 of us, and they don't seem shy. They really make us feel part of the healing process. My advice for future brigaders is to come here with an open heart, an open mind. I mean, anything can happen. It's an amazing learning experience, and I'd strongly suggest anyone to experience this. You don't have to be a medical student or a doctor to experience this.
NDI accepts international interns and volunteers in many different fields, not just medicine. We encourage anyone interested in attending an NDI Global Health course who is older than 18 and in good health to apply to our program. At the heart of our organization are our volunteer naturopathic doctors. Licensed naturopathic physicians volunteer their time from anywhere from 1 to 2 years, where they come and work with us in the NDI clinic here and serve as the primary care doctor to the people of Ometepe.
One of the most important things that I learned in public health school was that I truly believe that health is a human right, as stated in the Declaration of Health and Human Rights. And I feel like those in developing countries like Nicaragua have those same rights, but because of the fact that there's limited access to care, that their basic healthcare needs aren't met. So if I could just be a part of providing that care for them, I think that's something quite special. I feel like NDI in general provides the basic public health needs, which is to improve the health and well-being of the patients here. And we really do empower the patients by providing a lot of education so that they have the choices available to best take care of themselves and to empower them to make healthy choices, basically. I also love knowing that I'm working for an organization that really embraces social medicine, that embraces activism, and really promotes community building. And we do a lot of solidarity work as well in the community. So I love that we really get in touch with what the community needs and not just be the doctors here.
NDI has worked in collaboration with many different organizations: Witness for Peace, the Foundation for Sustainable Development, universities such as Stanford, Grand Valley State University, and others. NDI is a grassroots organization that completely relies on donations and volunteers like yourself. We encourage you to contact us if you're interested in helping us to grow this global health movement in natural medicine.